Breastfeeding is one of the most natural and nurturing acts you can share with your baby, but let's face it, it doesn't always feel natural right away. Many moms, especially first-timers, experience challenges in finding the right positions that make feeding comfortable for both them and their baby. That's why today we're diving into the best breastfeeding positions every mom should know. Whether you're just starting out or looking for ways to make nursing sessions easier, this guide has you covered. Let's start with the cradle hold, probably the most recognizable breastfeeding position. You hold your baby across your lap with their head resting on your forearm and their body facing yours. It's simple, effective, and works beautifully once your baby has learned to latch. But here's a pro tip. Make sure your baby's head, neck, and spine are in alignment. This prevents any unnecessary strain and ensures a better latch. Next up is the cross-cradle hold. Think of this as the cradle hold's supportive cousin. Instead of cradling your baby with the arm on the same side as the breast you're nursing from, you switch arms. This gives you better control over your baby's head and is a favorite for moms who are still perfecting the latch technique. It might feel a little awkward at first, but with practice, it becomes second nature. Now, let's talk about the football hold, also known as the clutch hold. This one is a lifesaver for moms who've had a C-section, as it keeps the baby off your healing abdomen. Imagine tucking your baby under your arm like a football, with their legs pointing toward your back. It's particularly great for smaller babies or those who struggle to latch. And here's a fun fact. Many moms of twins love this position because it allows for tandem feeding. If you're looking for a position that's all about relaxation, the side-lying position is your go-to. You and your baby lie on your sides facing each other. This position is perfect for nighttime feedings or when you're recovering from childbirth and need to stay off your feet. Just remember to use pillows to support your back and keep your baby at breast level. Safety first always. For moms who want to tap into their instincts, try laid-back breastfeeding or biological nurturing. Lean back in a semi-reclined position and place your baby tummy to tummy with you. This position lets gravity do some of the work, helping your baby find the nipple naturally. It's a wonderful way to bond and can be especially helpful in the early days when you're both learning. Now let's address a common question. How do you know if a position is working? Simple. If your baby is latching deeply, sucking rhythmically, and swallowing, you're on the right track. You shouldn't feel pain, and your baby should seem content after feeding. If you're experiencing discomfort or your baby isn't latching well, don't hesitate to reach out to a lactation consultant. They're experts at helping moms troubleshoot and find what works best. Here's a personal story. A friend of mine, Sarah, struggled with finding a comfortable position after her C-section. She tried the football hold, and it made all the difference. Not only did it ease her discomfort, but it also gave her confidence in her breastfeeding journey. Every mom's experience is different, but the key is experimenting until you find what feels right for you. Before we wrap up, let's debunk a few breastfeeding myths. Myth 1. You have to stick to one position. False. Switching positions can actually prevent soreness and help drain all parts of the breast. Myth 2. It's normal for breastfeeding to hurt. Not true. Some tenderness in the beginning is normal, but ongoing pain is a sign you need to adjust the latch or position. And myth 3. You should only nurse in private. Nope. Breastfeeding is natural and you should feel empowered to nurse wherever you're comfortable. So moms, give yourself grace. Breastfeeding is a journey, and like any journey, it comes with ups and downs. Celebrate the small wins, be patient with yourself, and don't be afraid to ask for help. You're doing an incredible job, and your baby is so lucky to have you. If this video gave you a boost of confidence or you learned something new, don't forget to like, share, and subscribe. Your support helps us create more content to guide and empower parents like you. Thanks for watching, and we'll see you in the next one.